I'm Julie Christopher, and I'm one of the specialists on Optimal Healthcare's Information and Resource team. Today, I'm going to be sharing some information with you about how Optimal Healthcare can help you apply for DDA services and provide a brief overview of our DDA coordination services. I will also tell you about our Information and Resource program, which is a free program we offer to communities across the state of Maryland. On the right side of this slide, you can find the QR code that will take you directly to the DDA application. All you have to do is point your smartphone camera at this black and white box, and your phone should be able to generate the link for you. If you need help completing the DDA application, you can reach out to Optimal Healthcare specialist in your region for assistance. Contact information for our specialists will be listed at the end of this presentation. When applying for DDA, you want to be sure to provide as much supporting documentation as possible. These documents will include the IEP, the BMP if applicable, and the most recent psychological evaluations with IQ testing provided by the school. It's important that the psychological evaluation has occurred within the last 3 years. Other examples of supporting documentation include any documents that show justification of need for DDA services. These may be police reports, documentation from private therapy services, and any relevant medical documents or hospitalization records. If you're struggling to locate these documents, Optimal Healthcare specialists can help you with obtaining relevant documentation to accompany the application. After your application is received by DDA, DDA will randomly assign a service coordination agency to complete a comprehensive assessment with you. A comprehensive assessment consists of specialists gathering the appropriate documentation and composing a report that will describe and justify your child's need for DDA services. Completing the comprehensive assessment requires an interview with the caregiver and/or individual to ensure that the report is personalized and reflects the individual's unique needs. Once DDA receives the completed comprehensive assessment, DDA will send you an eligibility letter within 60 days notifying you of their decision. Part of this letter includes the option to indicate which service coordination agency you prefer to work with. The letter will have a list of service coordination agencies in your region, and you have the option to choose any agency that you wish. You can indicate your preference on this letter and return it to DDA by mail, or you can call DDA and let them know your preference. If you don't indicate a preferred agency within 30 days, DDA will randomly select a service coordination agency for you. However, you can still change agencies at a later date. Once an individual is determined eligible for DDA services, they will be contacted by their assigned coordinator of community services, also called a CCS. The CCS will then help the individual obtain DDA services and assist the family with developing a person-centered plan. The Person-Centered Plan is an annual document that is used to maintain funding and specify goals related to DDA services. Generally, the CCS will check in to monitor progress towards goals in the PCP at least every 3 months. Of course, you can reach out to your CCS with questions or concerns at any time. The CCS can also assist with connecting clients to community resources that may contribute to the individual's vision of a good life. DDA considers those aged 18 to 21 years old as transitioning youth. During this period, individuals are considered to be on a wait list. However, they will still be eligible to receive CCS services. During this time, CCSs play the important role of connecting transitioning youth to needed community resources and helping them prepare for receiving DDA services at 21 years old. Information and Resource Services is a new program we're providing to our families. This service is free, and we really want to encourage families and communities to take advantage of this wonderful program. Information and Resources is especially helpful for those who are not currently receiving DDA services. We are able to help families and individuals find resources within their community, attend IEP meetings, and offer educational advocacy. We have partnered with a variety of agencies specializing in helping those with disabilities across communities in Maryland. In these partnerships, we have created educational workshops that specifically address the needs and challenges of the community. We also have been able to develop some recreational groups and classes that assist in community integration. Usually, we would provide most of our services in face-to-face format, but due to COVID-19, we have expanded our service delivery avenues to include communicating and collaborating via Zoom, Google Hangouts, and of course, making use of phone calls and email. So that's our overview of services and programs offered by Optimal Healthcare. On this slide, you'll see the contact information for the Information and Resource team. Carla Robeson is the Vice President of Community Partnerships and supports the Information and Resource team. Then we have our Director, Mark Weldon, and you can find his information in the top right bubble. In the middle, you can see our Information and Resource Supervisor, Carnella Coleman, with her contact information. Starting at the bottom left side of the screen now, we have Susan Cariola in the Western region, Linda Musiani in the Central region, and myself, Julie Christopher, working in the Eastern region. For support in the Southern region, please reach out to the INR Supervisor, Carnella Coleman. Thank you for joining us with this quick overview. Please reach out to us with any questions.